Welcome to Senior Moments. I'm Vickie Carraher, the Senior Service Coordinator for the City of Kettering. Today, this is a very reoccurring topic. We talk about it all the time, but it is in everybody's mind because you cannot turn on the TV without hearing these ads about Medicare. And most people thought, you know what, they'll go away when Medicare open enrollment is over. And they did for a week, and now they're back because we are in a new season of Medicare enrollment, and that is for the Advantage plans. My guest today is Tracy Goodpaster from the Medicare Connection. We're going to talk about all things Medicare as we have done. She's been with us before. So Tracy, let's kind of review the different types of Medicare because they're two different things. So Medicare, traditional Medicare, like most people think of Medicare, what's that got going on?
So original Medicare is Parts A and Part B. You can have a Medicare supplement along with that will take care of what Medicare Part A and B won't pay for. And then you should have a Part D drug plan, which takes care of your prescription drugs.
So what's the advantage of having that, no pun intended, separate from the Advantage plan? A lot of confusing things Medicare throws at us. So Part A, what do I get with Part A?
Basically, it's hospital coverage.
Okay.
Hospital coverage, Part B is the doctors, to make it easy.
I always say Part B is everything else.
Yeah.
It's, your lab work, your x-rays,
outpatient, everything.
All of the weird stuff that Medicare will pay for usually comes under Part B. So if we have Part A, how much does that cost?
If you have worked at least 40 quarters in your life or have a spouse that has, and you've been married for 10 years, I believe, you qualify for Part A at no cost.
I like no cost.
Yeah, it is expensive if you do have to pay for Part A. And then Part B this year went up to $170.10.
That was a big jump because it
jump.
Was $145.50, and then we moved to $171.10. I've been doing this for about 30 years. I don't remember that big of a jump in that cost. That really rocked a lot of people. Got the Social Security cost of living raise, yay, but then they turn around and take more out of your Medicare check. So that's very frustrating. There are a few people who are lucky enough, I say, to pay more, and why is that?
Because they made more from working from their work life, and it's called IRMA, income related Medicare adjustment amount, and it can get very expensive. Now you can appeal it if you do have an IRMA penalty added to your Medicare.
Yeah, my dear friend Teresa from Social Security puts this out all the time. So let's say you sold a business in 2020, and or you got cashed in your IRA and pulled it into an account for retirement. It makes it look like you're a lot wealthier than you really are. So what you need to do then is explain to Medicare, hey, this was a one-time thing, because what Medicare or Social Security is the one you pay your premium to. So what Social Security looks at is not my 2021 taxes, because I haven't filed my 2021 taxes yet. They only have access to your 2020. So a lot of people, because that's almost 2 years before, we don't think about that as having a retirement happen that year, or I sold my house, those kind of things. So you can file an appeal. You don't have to pay that really ridiculously high cost. So always keep that in mind. So Part B, you could pay, not have to pay for Part B as well. How does that happen?
So if you qualify for one of the Medicare savings accounts, you can, if your income is low enough, you can qualify for the state to pay your 170/10, which is a really great way to
Exactly, you
save
can
that
save
money.
a lot of money. So you see on these commercials, people, I get that, I don't pay that 170/10, and you shouldn't either. Well, the reason is some people don't have to pay that 170/10. It's based on income. It's not based on the plan you get. It is not based on anything other than your income. So in the advertisement, it says you could get, $150 back and not have to pay that bill. The reason that is they use the word could, not will.
Well, and they use the give back. It's so frustrating.
So explain the give back.
So there is no give back. What the deal is they take less out of your Social Security for your Medicare payment. So they're not going to put money back into your Social Security check. They're just going to take less out for your Medicare. So whether they don't take the 170/10, or if you have a plan that some veterans can get a plan, or anybody who wants a plan without a drug plan, they have Advantage plans that have a Part B reduction, is what it's called, by $50, $25, whatever it is.
But you have to be very careful of that. Is I can save $50 on my Part B premium, but then I have no drug coverage.
Correct. You definitely want to be careful about that.
And if I sign up for drug coverage, that cancels me on the other plan. So you have to look at the whole picture. I think sometimes, like, you're walking through Walmart, somebody goes, "Hey, come here, let me talk to you about your Medicare." And then you end up signing up for something, and come January, you find out, what happened here? This is not what I thought I was getting.
Yeah.
So because of that, with our Advantage plans, we have a new open enrollment period during January 1st to March 31st. Explain that open enrollment for me.
Well, the first thing I love is that they call it open enrollment, because Medicare calls the other enrollment period open enrollment also, which is technically the annual enrollment period from October 15th to December 7th. So in that time, you can add any plan, make changes, do whatever you want to for any of your plans. Now, starting January 1st to March 31st, it's called the Advantage Plan Open Enrollment, Medicare Advantage Open Enrollment. And you can do two things. You can, if you have an Advantage plan, you can change your Advantage plan to a different Advantage plan, or you can drop that, go back to original Medicare, and add a drug plan, a Part D.
So let's say I didn't realize my Medicare supplement is going to go up this year. And so I want to get on an Advantage plan now. Can I do that?
Not on this Medicare Advantage open enrollment. That's not what this is for.
So that would be the following October
October.
15th to December 7th. It is very confusing to people, because I one of my one of my volunteers who works in my office, I said, well, we have other people coming in because of the Medicare Advantage open enrollment period. And she's like, wait a second, I thought that was over December 7th.
Yep.
So October 15th through December 7th, you can do anything. Throw caution to the wind, look at all your options, change.
Add a plan if you never had a plan.
Add a plan if you never had a plan. You don't like your supplement anymore, it's too costly, you can go to an Advantage plan. You've been in an Advantage plan and it's nickel and diming you to death, you want to go for a supplement. Now, there are some things with the supplement, and we'll get into that in a few minutes. But during that open enrollment, October 15th, December 7th, do anything you want to do for the following year. This is just Advantage to Advantage. So let's say I got Anthem. There's multiple plans. I got one of the Anthem plans, went to the doctor, and the doctor says, March 1st, we're going to stop taking that plan. So I want to switch to a plan that my doctor is taking. Before before March 31st, you can do that.
Absolutely. And what you do is whatever day of the month you make that change, it will start the first of the month, the following month. So if you did
if I
it now,
did it today,
start February 1st.
it would start February 1st. So you can do that. So advantage to advantage. Now there's advantage back to regular Medicare.
Correct. So the thing about going advantage back to original Medicare, you're going to want to add a supplement plan to it, I would hope, to take care of the other stuff that Medicare doesn't pay. But you might not qualify. So Medicare supplement plans have different qualifications. If you're not just turning 65 or new to Medicare, you might have to go under medical underwriting.
Yeah, so medical underwriting means they can look at my medical situation and then can make a determination that I don't qualify.
You don't qualify, or they could rate you higher to where you'll pay more.
When I turned 65, because I never had the option of getting a supplement, I can get it without them asking me any questions. Let's say I stay in the workforce a little longer, because a lot of us, our Social Security full date is not 65, it's in the future, 66, 67. So many of us might want to not get in Medicare and keep working until our Social Security can get into effect. So those individuals, even though they're not 65 anymore, they have an enrollment period called what?
It's Medicare Supplement Open Enrollment too. Let's just keep using the same words. And what it is 6 months from the time you're getting Part B and over 65.
So that means if I had Part A with my employer insurance, and now I'm adding Part B, because you can't really get a supplement without Part B.
Correct. You can't get a supplement in the state of Ohio until you're 65 also. So I do have situations where I have somebody who is on Medicare under 65. Once they turn 65, they have guaranteed issue to get a supplement.
Yeah, because a lot of the people that are, if you're on Medicare under 65, you are disabled. And it is unfortunate, but disabled individuals cost more to care for. So the Medicare supplements don't allow you to join until you're 65. So let's say I'm 55 and I am disabled and I have Medicare. I have the option of Advantage plan until I turn 65. Then at 65, I have the right to get that, period. If I didn't join Medicare at 65, again, I can join it later with a special enrollment period because I used my insurance at work.
Right, it's coming off employer group coverage. And you have a special enrollment period opens up in that case to where you would, in some cases, some carriers will allow guaranteed issue. Some won't, but some will.
So are there any, what affects the cost of these supplements? Is it like regional? Is it your age? What affects the cost of a supplement?
Pretty much all of that. Also, your gender. So men are more expensive than women.
You see, most men think it's the opposite. It's really not. Guys, you're more expensive when it comes to Medicare.
Yeah, and it's not just a couple dollars. Sometimes it's $10 or $12 more.
A month.
A month, which is a little ridiculous.
Yeah.
But yes, the region you're in, and your age. Yeah. The older you are, the higher price you're going to pay.
Yeah. So individuals, you had mentioned that there is an Advantage plan for someone who may not need drug coverage, particularly those individuals who use the VA. And I like to say with the VA how important it is to make sure that you are certified by the VA. Not every veteran can walk into the VA and say, I want care. You actually have to prove a few things, that you served, you're discharged honorably. You have to do an income guideline unless you have some kind of service-related disability. So in that case, individuals who are getting their medications from the VA, they can get an Advantage plan and not get drug coverage with their Advantage plan. So that's kind of what a lot of those plans were meant to do. Now, some people may say, well, I'll take drugs. I want the Advantage plans without drug coverage. Then what happens to you?
Well, if they ever do join a drug plan, they're going to have a penalty. And the thing about with the veterans too is if they're on one of these MA only plans, they have to understand that they have to get all of their meds at the VA. So you can't do partial. You know, if you're going to go that way, you've got to go that way. But yes, if you do without a drug plan, you know, for more than 63 days, you're going to start getting a penalty.
And that's a 1% penalty for every month you do not sign up.
For the rest of your life.
For the rest of your life. It's not a one-time penalty. It is a for the rest of your life. You're going to pay more. So I always tell people, just because you do not take any medications, you still kind of have to have a drug plan.
Well, it's not required. It's not mandatory. And that's where the wording gets a little weird, you know.
Well, what I really love is they use the words optional.
Optional, but we're going to penalize you if you don't have one.
So if you're going to penalize me because I'm not doing something, using the word optional just doesn't seem like it makes a lot of sense to me.
Right.
When I run the world, people, it will be better. I promise. I don't now, so we're just going to have to live with what we have existing. So getting back to the Advantage open enrollment period. So if I want to go from Advantage to Advantage, if I'm going to say leave Advantage and go back to original Medicare, they can get a supplement if...
Well, if they qualify. So medically, if their health is good, if they haven't been to the hospital, had a hospital stay in the last 90 days. But the best thing to do is come see us or come talk to a professional and find out what the medical questions are to see if you're going to qualify. If you don't qualify, you don't want to leave the Advantage plan because once you get on the drug plan, it'll kick you off the Advantage plan.
Yeah, so you go back to original Medicare, you get that Medicare drug plan, it kicks you off the Advantage plan, and then you go and find out, oh, I can't get a Medicare supplement. There are a lot of gaps in Medicare. There's like $1,500, a little over $1,500 when you're admitted to the hospital. There's daily co-pays for day 61 through 90. Even after those co-pays are over, you could not have any insurance at all. So Medicare supplements go well with with traditional Medicare. That's what they were intended to do. You can't have a Medicare supplement and an Advantage plan. They don't go together. So it's really important. Again, if you're going to work past 65 and your employer has more than 20 employees, Medicare would be a secondary insurance anyway. You really don't even need to get your Medicare. And you don't have to worry about those penalties. What happens if I am eligible for Medicare and I don't get it during my enrollment period? Then how would I get it?
So that's what another enrollment period we're in right now. It's called the general enrollment period. And that's for Medicare Part B. So if you lived under a rock or something and forgot about your Medicare enrollment and you had no other credible coverage, I mean, you would have had to have no insurance at all. No credible coverage through ACA, through anything. Then you apply from January 1st to March 31st, but your coverage doesn't start until July 1st.
July 1st. So that's quite a gap to continue to go without insurance. A lot of people ask me, what if it's cheaper for me to do the ACA or the Obamacare plans? You can't.
You can't after 65.
Yeah, once you turn 65, the Obamacare, ACA, whatever you want to call it, you can't do those plans anymore. So let's talk a little bit about the procedure for change. What are the things I need to look at, consider, those kind of things?
Number one is your doctors. You really want to make sure, if you want to keep your doctors, your current doctors, make sure they're in the network for the new plan. And you can't just call the doctor's office because,
And never ask the doctor, I'm sorry if you're listening. If you're a doctor out there and you're listening, I'm so sorry, but your doctor doesn't know. In a lot of cases what insurance you take. They let their business office handle that. So asking the doctor, probably not the best idea.
Right. Yeah, you want to check your drugs too. Any medications you take, you would be surprised just the difference from one plan to another, what the difference of medication costs are. Not only one plan to another, but let's say you have to go to Walgreens, you despise some other store. You know, you want to find the one that works best for your pharmacy too. Going to different pharmacies, it's a huge difference on some of the medication cost also.
So each drug plan has a formulary, which is essentially a list of medicines they'll pay for.
Right.
If I take a medication and the drug plan I have, and I signed up knowing it didn't do that, do I have any recourse?
Not really. I mean, you can get a formulary exception or ask for some kind of situation like that. But no, if you knowingly pick a plan that does not cover the drug that you take, then that's your problem. Now, if you don't, we're going to talk about this a little later, but prescription drug costs, you don't have to use your insurance card. So there's a lot of good sources out there, Single Care, Good RX, Clever RX. The Kroger has a plan, Walgreens or Walmart has a plan. You know, sometimes you can save a lot of money that way without using your insurance.
So let's say I'm getting the cheapest plan. I only take 2 medicines. They're both generic. They're really, really inexpensive. I have because I got the cheaper plan, I have I can't remember the $485 deductible. So that deductible is large, and I may never reach that deductible. Let's say I have a Good RX plan, and it's my plan. It's going to cost me $12. Good RX is going to cost me $4. So am I allowed to use Good RX instead of my Medicare?
Instead of is the key word. You can't use them both together. So you use one or the other, and use whatever one's cheaper. I mean, and a lot of pharmacies will check that for you. So they will say, hey, I just ran this and it saves you a lot of money.
Yeah, I know my pharmacist is really good about going, hey, Vickie, your insurance is going to charge you more than this card. And that's always nice. So make a friend of your pharmacist, you know, take him some candy at Christmas, you know, butter them up real good, because they are very, very helpful when it comes to changing drug plans and for getting you the best cost. There's also an option out there that a lot of people don't know about, and that is prescription assistance programs. Now, I always say, if you saw a drug on TV yesterday, it's going to cost you thousands today. It's just when they market new drugs, they're very expensive, and a lot of what you're paying for is the marketing of the new drug. So each prescription or each company that makes a drug has a prescription assistance program. It may be a discount program. It may be that you pay $10 instead of $1,000. How would I look into those?
So most of the time the doctor can help you. The doctor can help you, or the pharmacist can help you. But you can contact the drug company directly. There's paperwork that needs to get filled out. Usually the doctor has to sign it, you know, fill it out and everything. But you could save a lot of money.
There is a website that I use called needymeds.org, NEEDYMEDS.org. You can go there, and in the search, you just put in the name of the drug. It'll then click on it. You go to their website. You see if they have a discount program, if they have a program. A lot of these drugs are really expensive. I had a lady come to me just this morning, just one of these new eye drops that's going to save her vision is going to cost her $1,000 a month. And she's like, I'm on Social Security. I don't have $1,000 a month. And so we're going to meet tomorrow and go over some plans. So there are options out there. Don't just assume that nothing's going to help. See somebody. See Tracy. See myself. You know, go look at it on the internet if you're internet savvy, because it's really important to, you know.
Well, don't just assume your insurance price is the lowest price for you.
Yes.
You know, ask around. If you don't ask around, you're going to get what you get.
One thing that I think is really, I see this a lot in people who come into my office. My next door neighbor has such and such. They have, you know, Anthem insurance, and it's amazing, and she doesn't pay a whole lot for her medications. Why is that not such a good idea?
Because everybody is different. I mean, even married couples are on different medications. They go to different doctors. Your neighbor might not be telling you that she qualifies for Medicaid also and doesn't pay anything. I get that all the time where people come in and say, my neighbor doesn't pay for anything. She's got a great plan, you know. How can I get that plan? You know, and,
Yes.
well.
Yeah, if you can get the Medicaid plan, and if you have any question as to whether you qualify for that Medicaid plan, talk to someone. I can give you, if you call, if Tracy can tell you Medicaid eligibility, because there are a lot of people who are out there not getting medications, not getting the care that they need, and they would have qualified for Medicaid.
And they just didn't know.
And it makes me sad. At least 10 people every year come in for open enrollment, and I'll look at them and say, you could get Medicaid. We need, and they don't have copays. So those commercials that are saying, I don't pay anything, I get money back, those are individuals who have Medicaid. So it's really important that we look at that. Also, I'm not taking the same medications that Tracy takes because we're different people. My husband takes totally different medications than I do. So each individual looks at their insurance from their individual standpoint. Getting what your neighbor says they like the best isn't really always the best way. Now, it could be. Let's look at that.
Right.
We can look at all the different plans. So how do they get a hold of you, Tracy?
So we're inside Town and Country Shopping Center on the east end of the shopping center, but our phone number is 937-823-6093.
They are right next door to the Kettering Connection. So Medicare and Kettering Connection are two different things, although we share a hallway and back door. So we are able to communicate back and forth. Lots of options out there for individuals. If you have a question about Medicare, if you have a question about any other service for seniors, any city programs that you might be eligible for, we're also going to talk about that next in the next couple months as well. So please contact us at the Kettering Connection at 937-296-3356. Thank you and have a great day.
Thank you.